Traditionally, healthcare has been focused on episodes in care, one point in time for a patient when they've been in the hospital. Today we need a complete view of the patient, and there are a few things that we need to make sure that we look for. The first one is their provider involvement. So who's actually taking care of this patient? Does he have a primary care physician? And if he does that primary care physician know that he's also seeing specialists A, B, C, and D? These other doctors are prescribing medications and treatment for him, and if his primary care physician doesn't know, they may get into trouble in providing things that are conflicting in interest. And we can't forget about those medical services. Is he having physical therapy or home health care? Do they know something, or have they learned something about a patient that the physician needs to know that we need to incorporate in the plan of care? A comprehensive medical history. We need to know about his lab values, chest x-rays, and his test results. But we also need to know about his mental health history. Has he had mental health illnesses in the past? Does that change the way we need to treat him today? Is he currently depressed? Do we need to take care of that first? Because we know that until his depression gets under control, he's not going to be able to focus on his physical health. And then medication information. Does he know why he's taking these medications? Does he know what they're for? Does he realize the importance of taking these medications as the physician prescribed? Although it's not just about lab tests, they are still very important. It helps to guide us in the treatment of that patient, knowing if what we're prescribing for him is working. And if it's not, then we need to come together as a team and see how does it need to change to benefit the patient more. And we can also use that data to identify any gaps in cares. So if our patient is 50 years old, we know he needs a colon screening for the first time. And we want to make sure that he gets those things as part of preventive care. Social assessment. Does that patient have caregivers and a social support system? Without social support, it's going to be very difficult for him to manage complex and overwhelming disease processes. Financial challenges. Can he afford his medicine? Oh, he's unemployed. Okay, let's look and see. Is there some kind of assistance we can offer him with his bills? Can we set him up with pharmacy programs? And then transportation concerns. A lot of patients can't get to their doctor. They want to be there. Part of our job is to help facilitate that transportation and get them to where they need to be. Patient acuity assessments. These allow us to focus the right amount of care on the right patient. So if patient Bill needs a lot of resources from us, and we need to find a pharmacist for him, and we need to find financial help and transportation. But Judy only needs us to go over just a few things about her medications. We want to make sure that we're giving Bill the time that he needs. Patient health literacy. We teach patients a lot. We need to make sure that what we're teaching them, they actually understand that information and are retaining that information.